Yes, and good morning and welcome to the Coffee Break Conversation. My name is Ritah Nandera. Thank you so much for being part of this show every single Monday, Tuesday, Thursday, and Friday to see that we share with you different information that is going to change your life. And every Tuesday, as we told you, it's always for Mengo Hospital. As we talk about health, the issues of our lives as Ugandans, what do you want to find out about your status? What do you want to find out about so many other diseases in our country? And today's conversation, we are deriving into the world, as the world commemorated the World AIDS Day yesterday. Today's conversation, we are looking into how this is, since our theme of this year as Uganda or as a nation, as a country, was commemorating the World AIDS Day, is overcoming disruption and transforming the AIDS response. It's what we are looking into today's conversation. And joining us is Mrs. Racheal Ankunda. She deals with monitoring and evaluation officer from the Department of Public Health and Research, that is Mengo Hospital. She'll give us more of the information we want to find out in our theme for this year's celebration of the HIV/AIDS as a country. Good morning, Mrs. Racheal, and good to see you on the Coffee Break Conversation.
Nice to see you too.
How are you doing?
I'm doing well.
I'm doing good. How is Mengo Hospital and your department, since you are the representative representing the hospital, and conversation as we're driving into the overcoming disruption, transforming the AIDS response in our country?
Well, we are fine. Mengo Hospital is fine. And today, being that it's the 2nd of December, and yesterday we were celebrating World AIDS Day. Our department, which is the Department of Public Health and Research, which is in charge of offering HIV care and all the prevention care at the hospital, including also participating in research, sees this as an opportunity to share more, because World AIDS Day is about raising awareness about HIV. So this is a great opportunity to be with you today.
Amen. Great. Maybe a brief recap. The reports showed encouraging progress in Uganda's HIV response, with 94% of Ugandans now knowing their HIV status. Then 90% these are on treatment. Then it was showed also that 96% are achieving the viral suppression. What is your take point about that before we dive into this other information?
Okay, so as a country, Uganda set out with a 95-95-95 target. This target was that we ensure that 95% of the population knows their HIV status. 95% of those who are HIV positive enroll onto care. And 95% of those who enroll onto care achieve viral suppression. So as Uganda, when you compare where we are, with a target of 95-95-95, what those statistics tell you is that 90 know their status. The gap is 5%. Of those 90% who know their status, we have 94% have enrolled onto care. So therefore that gap is even lower at 1%. We have only 1% to bridge the gap. And then of the 94% who are already enrolled onto care, 96-97% have achieved viral suppression, meaning that target we have met it and actually exceeded it. So we are doing, I would say, considerably well, actually well, because you say that we are not so far away from meeting these targets.
If you're looking at these statistics, how they are, the percentage, you to compare it in the past years, how has it been?
Well, it has been, as you know, the HIV response in Uganda has been an uphill trend. We started with the response started in the 1980s, and you remember in the late 1980s, early 1990s, we had a very big prevalence as a country, and we have done a lot that today we are talking about even meeting a global target. So yes, there has been considerable improvement as a country. I think we can proudly say we have we have made significant strides.
Yes, true.
Yeah.
All the statistics gave us energy yesterday. Show that there is really something that we are doing as a country to see that all these things are being dealt with. Now back to our theme of the year. I think we're looking at overcoming disruption and transforming the AIDS response. What does this mean simply in terms for our listeners?
Okay, so this year's World AIDS Day theme, which was overcoming disruption and transforming the AIDS response, is a global theme, but it's the theme we took up also as Uganda. And as we have said that the response has been, this has been a response over time. We have fought HIV over 4 decades, and now we are moving to a goal of ending AIDS by 2030.
Yes.
So now, as a listener, when you look at overcoming disruptions, you will see that since the COVID times, actually in everyday life there are disruptions that affect health seeking, HIV testing, adherence to ART. These disruptions could be financial disruptions as people lose jobs, as economic situations change, as political situations change, as we experience changes in COVID which have somehow not gone away. We want to stay focused. We want to stay focused to ensuring that we remain focused on the goal. We want to use these disruptions in a way, view these challenges positively, and see how we can innovatively work around these challenges to still go ahead and transform the HIV response. In other words, when you look at maybe people not having better access, can you bring the services to the community? When you look at people getting maybe developing different kinds, changes in attitude towards treatment, can we encourage them? Can the community raise awareness? Can we end stigma? So the goal is to overcome these disruptions and still remain focused and transform the HIV response and achieve the goal of ending AIDS by 2030.
Yes, you mentioned about the access of the services being extended near to the communities and also the treatment. Realize that it has been an issue, a challenge, that when it comes to the part of the treatment, that most of the victims, can I call them those who are having this HIV/AIDS, they have been fearing to go for the treatment, and which has also caused more how can I describe it for you to understand this? That the majority of them have decided to stay back and sit with this virus in themselves because they fear to go for the treatment. How have you dealt with that as a Mengo Hospital when it comes also to the sensitizing the public about stigmatizing these people? That is not a good thing, and I think also it has added up to the fear of these people to access the treatment in the hospitals.
Okay, so as Mengo Hospital, being that we are a faith-based hospital, we are founded, we have a strong pillar in the Church of Uganda, and we offer care witnessing to Jesus Christ. One key thing is that we encourage, and we want to encourage people to realistically view HIV/AIDS as a medical condition, not as a moral failure. This has contributed a lot to how people perceive care, because the community, as a country, as a community, as a church, we have associated it, because of its mode of transmission being sexually transmitted, as a moral failure. And every time you judge the disease as a moral failure, then you have a less, people are less likely to uptake the care, because they feel you're pointing fingers at them, you're judging them for having HIV. So when we appreciate HIV as a medical condition, for example, when someone is seeking care for diabetes, there's nothing wrong with that. And likewise, there is nothing wrong with someone seeking care for HIV/AIDS. So when people fear, the first entry point to care is testing. So when people even fear to test, then there is no hope to ending this epidemic, because you will not know your status. When you're negative, you will not even be able to do those things that keep you negative, because you're always guessing. So one thing is that we encourage that as a community, as a country, let us do our best to end the stigma against HIV. HIV is a medical condition, and it is treatable, may not be curable, but it is treatable, and you can achieve a very good quality of life with treatment. And we want to encourage people to know their status, to embrace care, and to embrace prevention services for those who do not have this disease.
When you talk about the services, as Mengo Hospital, what percentage have you extended these services to all the parts of this country?
Okay, so HIV services, as you know, they are, every part of this country has HIV services, but as Mengo Hospital, we offer care to a considerable number of people. We are proud to say that we have the biggest number in the faith-based network. So our services are open to, we offer prevention services, we offer care and treatment services, and they are open to all people, all Ugandans. But one major focus with HIV care is that as a Ministry of Health, there have been things that we have done to ensure that the access is equitably distributed. So we do not encourage someone to come from Hoima to come to Mengo. No, we have a catchment area, and so when you come maybe for another service and you seek testing services, we give them to you, but we refer you to where it is nearer so that you can get services. So our services run from the whole prevention cascade, HIV testing, safe male circumcision, prevention of mother-to-child transmission. We offer pre-exposure prophylaxis. We offer post-exposure prophylaxis. We offer HIV care holistically, and we welcome those who are within our catchment, but we also encourage even those who are not in our catchment to test and seek care where they can access it.
Talk about the mothers you have mentioned about. How are you dealing with them, being that they could be having this virus in them, but the baby are not having it? So how are you dealing with that as Mengo Hospital?
So one of the key pillars of prevention is elimination of mother-to-child transmission of HIV. And it is one of the things that has registered significant success, because, for example, at Mengo, we have a zero transmission rate from mother to child. When I say a zero transmission rate, it means that no mother who is HIV positive ends up transmitting the virus to their unborn child. And how do we do this? There are medical interventions. Pregnant women, that's why we encourage every pregnant woman to test. And we have now even reached a point of encouraging that when you test at the first time you come to the facility, we encourage you to retest 3 months later, because we have found that previously people tested once, and 3 months in the road of pregnancy they got positive. And they kept with the hope that since they tested negative at the beginning, they are still negative. And those were the few gaps of children who would get the virus. So we test you at the first time you come to the facility for antenatal care. We offer you education on how to keep negative if you're negative. And for those who are HIV positive, we enroll them onto the prevention of mother-to-child transmission program. And therefore, we get this mother and we give her ART for treatment of the HIV infection. And they achieve, usually within the 6 months, they achieve virus suppression. And when they continue with the ART through breastfeeding, There are also interventions we give to the unborn, to the baby at birth and throughout the first 18 months of the child's life. And this has helped us ensure that actually no mother transmits the virus to their baby.
Should we say it's really seen? It's rare?
No, it's actually not rare. It is something that has been proven by research that if you implement a successful prevention of mother-to-child transmission program, you will achieve zero transmission. So the thing that we call upon the public is that when you see a pregnant woman out there, there are many people have different choices. There are some people who choose to deliver in community, in their homes. But one thing we want the community to know is that it is important to test and at every pregnancy. Not just because with your firstborn you were negative, now you think with your fourthborn you're still negative. HIV transmission is changes anytime. And that's why we say, why the stigma? Because you're negative today, you don't know what will happen tomorrow. So at every pregnancy, we encourage the pregnant woman to test, and we encourage this to be more community-led, in that if you find someone in the community, refer them for a self-test, but ensure that they test, and if they are positive, refer them to a health facility so that they can enroll onto this program. There is a definitely high success rate. There is no reason you should have an HIV positive baby in this day and time.
Should we say even the mothers in the rural areas know about this information? Because it seems like since it's unpredictable, someone may test at the beginning maybe of the month, then the other 2 months she may forget about that. Especially now I'm looking at the women in the rural areas who have no maybe information about this. Are they safe? Should we say that?
Well, the truth is a pregnant woman should seek antenatal care.
Yes, exactly.
The benefits of antenatal care are numerous. It's not only HIV prevention. There are many things there are many good benefits of antenatal care. One of them being that it enables you know your HIV status, and actually antenatal care should be attended between the mother and the child, and the husband, I mean. So when the husband is also coming to the facility, we test him too. So as a couple, they take charge of their HIV status. There also are many other benefits. There are supplements that you get. There is a scan that helps you to detect any abnormalities early and get medical interventions. So the first thing is that in urban or rural areas, we encourage that any pregnant woman should attend antenatal care. It has many benefits. And we also encourage that because we as healthcare workers, we have appreciated the different health-seeking behaviors of our community. But what we want to put across there is that the first thing would be attend antenatal care and get the full package of care. But if for some reason you cannot attend antenatal care, can you at least have an HIV test? Because you do not want to infect your child with HIV and have this child living with HIV from day zero to the end of their lifetime. This can be avoided. There is no reason to live with the guilt of that. You can prevent HIV to this unborn child.
Quite interesting. We're looking at the major disruption that are affecting the HIV service delivery. Maybe highlight for us some of them, and we see how are you able to overcome those ones as a hospital.
So one major disruption is these are some of the major disruptions are personal factors, I would say. Things like people having a poor attitude towards testing.
And I think that's one of the most common things we've seen around.
Exactly. And this is a problem, actually. It affects generally all of us, but it affects men to a greater extent. So men are less likely to test for HIV. And therefore their access to care will be limited because they do not know their status. So There may be other personal reasons, and some of the personal reasons include, if I know, then what? And that's what we're answering, that if you know there is care, there are services, you do not have to move from HIV infection to the full-blown AIDS disease where you're thin and everyone sees that you have this disease. No. In this day and age, there is no reason for you to have AIDS.
Yes.
You can prevent that, and that is why now we have the test and treat. As soon as you're found positive, you are treated. When you're found negative, you are linked to services that keep you negative.
That's right.
So one major disruption is those personal factors that reduce our access to testing, our access to seeking care. Some of the personal factors may be things like financial constraints, where someone doesn't have transport to go to the facility, and that's why we encourage referral. When we see you as a patient, we see your needs. That's why HIV care is now patient-centered.
Okay.
When you meet me, you look at me as the patient and you see what works best for me. And then you tailor my package of care to what works best for me. Then the other disruptions may be things like, we have had things like stigma. Stigma has been a major disruption to HIV care, and stigma is something that is a community, call it community disease, because once we point fingers, once we judge, people fear. They fear to test, they fear to seek care, and eventually when they are bedridden and sick, we all see it. So the stigma has been something that that has hindered HIV care. We have also had some external factors. For example, in the recent fact, we all know that there has been reduced donor funding to the HIV world, and there has been an increase, and the drive is as the development partners have supported the HIV care in our country for a long time, and for sure we are grateful, because the achievements we see are because of their support. But as their priorities change in their different governments, so does the funding change. So with this reduction in funding, it calls on us as the local implementers, as the health workers on ground, to find innovative ways that work. We cannot give up the fight because there is no donor funding. So you will see that every facility goes out of the way to find ways. For us as Mengo, we set out to reach men. We found them where they work, in the garages, in border stages, and we offered them a test and encouraged them to come. There have also been strategies, different strategies, that you look at what your community needs and you work with them. For example, we have had self-test kits distributed by border men, and they have reached communities, and those who are positive have actually come to care. As a country, you will see that the strategies for testing, for notification, for example, if I'm found positive, they list my sexual partners and they call them for testing. It has become more proactive to ensure that we reach the last mile, that anyone who is HIV positive out there gets access to care. Yes, those are the...
In other terms, should we say that the term HIV/AIDS is an expensive thing that really, if you're looking at donors coming in on board to get more money and funds to deal with this thing, it really calls it that it's something which is expensive, and it's not something which is likely that many Ugandans could be taking it so slightly like that someone doesn't want to know about their status, and then the outcomes is going to be negative.
Well, I don't want to use the having any disease is expensive. Healthcare is expensive. So whether you have malaria, let me use an example that people associate with and are comfortable with. If I had, for example, malaria, and it is in the initial phases, it would mean that if I tested and indeed I have malaria, I can get oral medication, Coartem, and take 4 times 2 and recover. But if I leave the malaria to move from where it is to become more complicated, that will mean that I need IV quinine. IV quinine is definitely more expensive than the oral treatment. It also requires me to be admitted. That means as a mother, I'm going to leave my home, go for admission. It also means it has become more complicated. It has affected more organs. So when you move it from the example of malaria and you take it to HIV, when you identify the HIV infection in the early stages, before it has for lack of a better word, colonized other body organs. That means you can contain it in its early stages. That means you can achieve viral suppression at an early stage. That means you can achieve a better quality of life earlier. That means you're even less likely to transmit it to other people. So for HIV, like all other infections, in the current state, we have free treatment. Most of the testing is free. So when you have access to free testing, free treatment, and you do not use the chance, are you waiting for the chance when it's no longer free? I mean, what will you do at that time? So we encourage us to take actually this as an opportunity. It is actually a blessing that we have these services with us free, and all of us should utilize them.
Great, yes. Allow us to get into a quick commercial break. We are still driving into this conversation of the HIV/AIDS, which is kind of like a problem, or a problem to so many other people, but this time round we are so grateful as a country that there is a very big change. We will be coming back with more of the conversation. Just stay tuned on the coffee break. Yes, and welcome back from the quick commercial break. Just to ask you one question, do you know your status? Are you HIV positive or negative? All this information we are doing is to sensitize the public to alert you and to ensure that you go for the testing, to ensure that you live a healthy life. Knowing to say that I shouldn't go because of this and this. No. The earlier the better. Yes, still with Madam Patience. She's giving us more the information comes to this matter of the HIV/AIDS. And right about now, I want to look at what are the best ways we can be able to prevent the HIV/AIDS today as a country, and all our viewers who are listening us to this conversation. Yes, Madam Patience, what is your thought about that?
Okay, the prevention of HIV still the ABC strategy works. Yeah. A being abstinence for the population that can abstain. Yeah. B being faithful to one sexual partner, and the consistent condom use. That has worked from the start and it still works. It's just that with time we have had more interventions that work, and currently we have biomedical interventions. These interventions, for example, that target different groups. For example, we have safe male circumcision. Circumcised males were found to have a 60% reduced risk of acquiring HIV. So it is an intervention that works for males. So it's something we encourage, that if you have a son, you can circumcise him for the purpose of HIV prevention. And then we have interventions that target pregnant women, that is the testing in pregnancy and therefore the elimination of mother-to-child transmission program. Then we have interventions also that target high-risk groups. I will put some emphasis on these high-risk groups. There are people who are at greater risk of acquiring HIV, and these are people like commercial sex workers, men who have sex with men. They are at a greater risk. And surprisingly, more recently, we also have adolescent girls and young women. These are people from 10 to 19. So any young girl, your young sister, your daughter out there who is 10 to 19 is also at an increased risk. And these people have been targeted with pre-exposure prophylaxis. These are people, they are given ART, antiretroviral therapy, for the purpose of prevention. They are HIV negative, but because of their increased risk, they are given a type of antiretroviral medication that enables them to keep negative. Yes, so it may not be given for life, but it is given for the period where they are at greatest risk. So the pre-exposure prophylaxis works. And then there are also special categories like health workers. They know that they have post-exposure prophylaxis. So yes, these prevention methods work, but the thing that we encourage people is the entry point to care and to prevention is HIV testing. So make it a point to test. You can, and the testing modalities are now vast. You can do a self-test. You can go to a health facility and test, but when you test is when you start to know, how do I keep myself negative, and how do I keep, when I'm positive, how do I achieve the best quality of life? And also as time goes on, people got tired of the ABC, but it works. Yes, so it truly works. Yes, so basically when you get tested, for those who are still young and not sexually active, parents, guardians, as a community, we need to encourage young people to abstain from sex. The longer they abstain, the more they can prevent HIV. And for those who are sexually active, they need to be encouraged to be faithful and consistently use condoms. Yes.
Interesting. Now, looking at why is it important to stay on the treatment for our viewers who are listening, as they may think maybe this treatment. I think most of the times I've met some of these people who are having this disease, and some get tired. They get tired maybe because I think also it's the main reason as to why at times the improvement is kind of low. Should we say that's it? So why is it important to stay on this treatment?
Okay, for people who are HIV positive, they are linked to care. They are enrolled on a lifelong treatment, which is usually a group or a combination of drugs that we call antiretroviral therapy. Now, this treatment, we make it clear from the start that it is a lifelong treatment. It means that you're going to take it until your end of life. Now, why it is important for you to stay on treatment is that this treatment does not totally eradicate the HIV virus, but it suppresses it to a level that it does not have the ability to cause your immunity to be low, to cause you to get all these different infections that you could get if you are not on treatment. Therefore, it makes your body as strong as a person who doesn't actually have HIV. It reduces the virus to a level, and that's why when people are on treatment, the aim of treatment is to achieve virus suppression. By virus suppression, we mean we want to suppress the HIV virus to a level that the copies that we see in your blood are almost non-existent, where we say your virus is undetectable. When they say your virus is undetectable, it doesn't mean that you have cured. It just means that you have taken your treatment so well that it has suppressed your virus to the level that the lab test is not seeing those copies, or is seeing the copies that could be ignored in your blood. So why it is important is once you take your treatment well, you achieve virus suppression. Now, virus suppression helps you as the HIV positive person to not get sick, to not get infections, to live a good quality of life as a healthy person. But it also helps you on the other side, for us, which we perceive as on a public health side, even when your risk of transmitting this virus to another person becomes very minimal. And that's why we say that undetectable equals untransmissible. So in a way, holding all these other factors constant, even without this other prevention, active prevention, a person who is undetectable has a lower chance of transmitting the virus. So if we achieve that, it helps us not even to have these onward transmissions. So it works twofold. It helps the person with the virus, and it helps the community because the transmission is considerably reduced.
So should we say the treatment for the HIV is mostly on the drugs, or do they also take injections? How is the treatment? How is it?
So currently in Uganda, the treatment for HIV infection is mainly with oral tablets. And usually the tablets are a combination of tablets to make it as effective as possible. Now, there has been a lot of talk about the injection, and now that you raise it, in Uganda, the current injectable antiretroviral therapy that we have is being used for prevention. Because as a country, there are steps we take. I don't want to preempt that discussion, but the current antiretroviral injectables that we have are for pre-exposure prophylaxis. They are being used to target pregnant women who are at risk, who are HIV negative, but are at risk of acquiring HIV, breastfeeding women who are HIV negative but are at risk of acquiring HIV, and they are being used for adolescent girls and young women who are at an increased risk of acquiring HIV. When we judge it and we talk to the patient and we see that they are at an increased risk. Yes, injectable antiretroviral therapy for treatment exists, but it has not yet been scaled up in Uganda. But the oral antiretroviral therapy is very effective. We have a virus suppression rate as a country of 96%. So really you cannot doubt its efficacy. Yes. So it's the new thing on the block is the injectable, but I do not want people out there to underestimate their treatment. The oral treatment works, it's effective, people are achieving viral suppression. We have patients who are as old as 85 years old who got this infection when they were as young as 45. So really, and they are living quality lives. They are grandmothers, they are productive, they are looking after grandchildren. So I would want to encourage people to, as it comes on, we'll embrace it. But for now, what we have are tablets and they're effective.
Should we say the more the patients adhere to this treatment, the more they become better and do not draw back to maybe the weaknesses? What are the challenges you have encountered so far in that area when these patients are trying to access treatment, others do not access treatment? And has it been a disturbance to you, the people responsible for this?
Yes, when patients don't access treatment in time, for sure it's a challenge because they come in very sick.
Yeah.
And when you come to a hospital very sick, naturally you know that the survival rate becomes reduced. Yeah. So when someone comes to hospital healthy, walking, and it's a different, we predict a better outcome than when a person comes bedridden with so many other comorbidities. They have pneumonia, they have meningitis, they have they have so many illnesses. So you're treating them they have tuberculosis. So they may not necessarily even die of HIV. They usually die of these other infections. Okay. Usually people who die with HIV do not die of HIV. The mechanism is that HIV weakens your immunity, so that these other diseases will get access to your body and kill you. So it is definitely better that people come in earlier, and seeking treatment late makes the outcomes more likely not to be favorable. You're less likely to survive. So, and the aim of treatment is to increase the survival of any patient, to improve the quality of life. So the urge is that test and seek care early. Yes.
You mentioned something that captured my mind when you talked about the signs and symptoms these days are not seen. So how safe are we, most especially the young ladies and the young gentlemen out there? Because you can find even a good-looking person not knowing that he or she may be having this virus. So what is the wisdom? What is the knowledge? What would you advise the young people out there when it comes to, gone are the days whereby you would tell this person is HIV positive because of the things, the signs and symptoms on them. So what about now? How is it standing? Okay,
so I think I would tell not even only young people, but all of us, is that HIV is not a disease that is diagnosed by observation. You do not look at me and say that, oh, I think, Racheal, you have HIV. Because HIV, when well managed, leaves you as healthy or even healthier than you were before. So the tendency for people to want to make a diagnosis or to make a judgment about one's HIV status based on seeing them is a very wrong approach. The approach should be you test, and if it is young people who are seeking maybe to get married, they need to test together, and they need to test for, in a healthcare setting, we will advise you to test not only for HIV, there are other sexually transmitted infections. There are also other genetically linked infections like sickle cell, so that you make a decision when you're well aware. So do not judge HIV by looking at people. Yes, and that is why because HIV previously was judged by looking at people, even now sometimes people with a lot of stigma, even when they know that you have HIV, they think that, oh, I've sat next to you. No, it is a disease that is transmitted sexually, and you will not get it by sitting, sharing a plate, or being a friend with an HIV positive person. So the testing should not be with the aim of stigmatizing. The testing should be with the aim of knowing a status and making an appropriate decision.
Yes. You again mentioned something which was kind of interesting too. I think it was over among the public that showing a plate with someone who is a victim to the HIV/AIDS, you'll be getting this virus also. I think when you cut yourself with a razor blade and the blood connects, also they would say it would also cause someone to be infected with that, and so many other things. Maybe you can give us a highlight about that.
Okay.
Yes.
So now, for example, let us clearly categorize this. HIV is a sexually transmitted, but also a blood-to-blood transmitted infection. So in other words, it is transmitted sexually.
Yes.
And it is also transmitted when the blood of an infected person comes into contact with the blood or with the tissue of another person. That is why we even encourage people when they are nursing others to know the status of this person you're nursing, so that you do not, you take precaution. So people need to know that, fortunately now culturally we have less of that kind of culture practice where we have blood-borne pacts. But yes, when you share sharp instruments, you will get HIV. The old school teaching of to avoid HIV, do not share razor blades, do not share nail cutters. Be particular when you go to pedicures and manicures to take your own instruments, because the person who left right after you, most of these places do not even are not going to disinfect this equipment. So you do not want to get HIV in such a manner. But the main route of transmission is sexually. We still don't even say that the main route of transmission is mother to child, because that has been considerably controlled. So that is how we get HIV, sharing sharp instruments or sexually. The other routes, sharing plates, hugging, sharing a bed, no, you will not get HIV.
Interesting. Yes, as you're winding up in just 3 to 2 minutes, many new infections are now occurring among the young people. What is your message to them, and what message should the listener take away from this year's World AIDS Day that we celebrated yesterday?
Okay.
Yes.
So the young people out there, especially the young girls, I will speak to the young girls particularly because research has shown that they have a much greater risk of acquiring HIV. These are people who are 10 to 19, very young girls, our daughters, our sisters. I encourage you to because they know, but I want you to sit down, and some of these decisions are personal decisions. When you get HIV, you've gotten a lifelong infection, which you're going to treat for the rest of your life. You need to make a decision if these few minutes of pleasure or this phone that you're getting from this partner is going to be worth the lifelong treatment. So I also encourage parents out there, they need to be open. They need to sit down with these young girls and with these young boys and talk to them. Long ago, there was a lot of talk of HIV transmission, and sometimes here there is a tendency to fear even pregnancy more than HIV, yet pregnancy ends, but HIV is lifelong. So let us be very, very concerned about the young population and take time to educate them. And for the listener out there, those who are, one thing I want to tell you is that please know your HIV status. HIV status is not a permanent status. It can change. So please, at least once a year, test for HIV. If you're negative, take up the prevention strategies. If you're positive, embrace care and you'll live a healthy life. And from our Department of Public Health and Research at Mengo, we just want to invite you that if you're scared and you're out there and you're in Kampala and you want to have an HIV test, come. Even if you want it so private, we'll give you a self-test. All we want is that the result, we do things that keep you negative And if you're positive, we link you to care.
Okay, thank you so much. So we have come to the end of this coffee break conversation. That has been Mrs. Racheal Ankunda. She is monitoring and evaluation officer from the Department of Public Health and Research, and that is Mingo Hospital. And we were talking about overcoming disruption and transforming the AIDS response. That has been the theme of this year's What is Day commemoration that happened yesterday. Let's be intentional as the public out there to ensure that you get to know the status of yourself before you want to find out someone's status. Be the number one person to go and check out if you are actually positive or negative. And of course, to the young people, you had it out that you need to be intentional, ensure that you keep your lives healthy and safer for the better future. My name is Ritah Nandera. Thank you so much for being part of all this show. Allow us to wish you a blessed Tuesday. See you then. Bye-bye.